One of the biggest needs that I see in the community for women is education. We are lacking vital education for women before, during, and after pregnancy. And this is one of the main reasons why I started Balanced Holistic Health in the first place, is to bridge the gap, to fill in the holes, to fill in the blanks for women so that less and less moms are saying, I wish I would have known, or I wish someone would have told me. So when I'm talking about education for women, the first thing that I really think women need to be educated on is how their bodies work. I see a lot of women who are having issues with fertility and issues with conceiving, and sometimes it's as simple as figuring out the ovulation window. And it floors me that these 30-something-year-old women don't know when ovulation is or how to make a baby. And that in and of itself, I mean, the inner workings of the female body, your body, you need to be educated on. So filling in the gaps there with, what is the female cycle like? Why does it happen this way? What is actually going on? Is the first step, because that's where we start, right? Whenever we're trying to have a baby, is with our cycle. Now, with the conversation moving to fertility issues, a lot of women don't know that what they're eating and how they're exercising is affecting their fertility levels. So lifestyle plays a really big role in our chances of conception. And so the information and education needs to be there before just saying, oh, you can't get pregnant, we're going to push you into IVF. I think that is a problem, because instead of just choosing IVF, it could be as simple as just changing your diet, balancing your blood sugar, exercising less intensely, or exercising more if you're not exercising at all. A simple lifestyle change can have a profound effect on your fertility instead of just jumping into IVF. We need to assess, what are we doing on a day-to-day basis? Because whatever you're doing on a day-to-day basis, if there's no true organic problem with your reproductive system, is causing these issues. So education for how your cycle works, and then also how your lifestyle affects your cycle, and finding practitioners who are willing to get to the root cause of what's going on with you, as opposed to just pushing you into fertility treatments. Now, once you become pregnant, a lot of the issues that I find for pregnant women is that there's a lack of education on different ways to have a baby, different birthing options, different birthing environments, different places to have your baby, different positions, all of it. I think that the birthing system has been heavily infiltrated by Western medicine. It's something that is a medical procedure now, instead of something that is a normal biological response. And so to move away from that medical, this is what's being done to you, to a more natural, this is what your body does kind of education is also really important. I think offering education on birth and offering more support and opportunities to hire a doula. I think offering more flexibility for women, how they choose to birth. If you're in a small town and things have been done like this and this is not the norm, you shouldn't be ostracized for that. You shouldn't be made to feel small for that. I think every woman deserves to feel comfortable and empowered with her decision to have a baby. But I do think that we have been kind of taught to fear birth, and then also that birth is gross. So we've been heavily kind of misguided with the birthing process and kind of pushed into, this is disgusting, and this is something that we need to just kind of get through. So don't educate yourself too much. Don't over-educate, because this information is scary and it's going to be horrible. So just kind of stay blind. That is not helpful. I think that when you are doing something as big as birthing a baby, you should know what is going to happen, what could happen, so that if you're on the small percentage of something happening to you, you already know about it. You have the information. It shouldn't be scary. There's ways to educate on birth without totally freaking everybody out. And so I think it's important to Be very mindful of who you talk to about birth, because we love to share the trauma. We love to share the horror stories of birth, but very few people feel confident and comfortable enough sharing a beautiful birth experience, sharing the great things that happen. So what are you reading? You want to make sure that you're reading something or educating yourself with something that's really positive and affirming, as opposed to here is a blog full of all the bad things that could possibly happen. You also want to make sure that the information you're getting is well-rounded, so that you're not just getting one-sided information. When women have their babies and they've done no research on anything, that is not informed decision making, because you didn't learn anything, you didn't research anything, you didn't weigh the pros and cons. That's not informed decision making. Whenever you're not informed in the decision making process, whenever you're not educated to choose what's happening with your body, that leads to dissatisfaction with your birth experience. That leads to a feeling of not being able to be in control of what's going on with you, okay? And so I think that, our doctors just go by the book. No one's trying to make you feel less than. They're following by the book. And so if you follow by the book because you didn't educate yourself, then I think it's really important that we have to kind of shift that. We have to be the ones to say, hey, I'm pregnant, and this is how I see my birth going, to your provider, instead of, hey, you're pregnant, this is what I'm going to do to your body. So taking back our power, educating ourselves fully. You might not want to have an unmedicated birth. That's fine. But you might choose things like immediate skin to skin, or delaying the cord clamping, things like that. That might not be normal procedure for your hospital where you are. So being open to creating a list of birth preferences that work for you and that resonate with you is really, really important, because I've heard a lot of women come back and say, oh, I didn't even know that was an option. I didn't even know I could do that. And they want to. So educate yourself with well-rounded information during pregnancy. I also think it's important to find a provider who is on board for you and your pregnancy, and not someone that you have to kind of fight against or advocate against. So be really specific in choosing your healthcare provider and your hospital or your birthing center. For postpartum moms, again, we talked about doctors can't know everything. And so when a woman comes in postpartum and she's assessed at her 6-week appointment and the doctor gives her the thumbs up, that does not mean that everything is fine to just resume life as it was. Have as much sex as you want, work out like a crazy person, go back to lifestyle as it previously was, you're great. That just means that medically you are considered past the postpartum period and healed. I think it's up to doctors to start to refer out to pelvic floor physical therapists. I think that it's important that they refer out to pelvic floor PTs during and after birth. I think that 6-week mark it's arbitrary. That doesn't count as good to go, jump back in. That 6-week mark should be, okay, your time with me has come to an end, so I'm going to funnel you into the next step for you, which is pelvic floor PT. For pelvic floor PT, and working with a pelvic floor physical therapist, that is vital. I mean, the pelvic floor is a muscle just like any other muscle system in the body. If you pulled your hamstring or if you tore a bicep muscle, you wouldn't just leave it and hope it goes away and keep using it anyway. You would stop and go to a physical therapist or a physio and get them to address it. Okay? So the pelvic floor is the same thing. If you have any type of tearing, any type of trauma, that needs to be addressed. Even if you don't have tearing or trauma, you carried a bowling ball inside of you for 9 months. That's a lot of pressure on those muscles. So they are going to be fatigued. They might even be tight in some areas just because of that pressure. So go to pelvic floor PT. The pelvic floor physical therapist, in my hope, would refer out to a postpartum fitness professional, because you don't want to just jump back into the same intense exercise that you were doing before. It's important that you find a professional who can help you scale your exercises. So I start with my clients in an initial phase for healing, and then we move into strength building, and then we move into endurance. We can't flip-flop or just say jump right back in. It has to start low and slow, and it has to be tailored to each person. So if you worked out all through your pregnancy versus someone who didn't work out at all, obviously you would be on a different fitness level. If you had a 3rd-degree tear versus someone who didn't have a tear at all, we're talking about different cueing, different fitness level, different healing times. And so it needs to be individualized and then low and slow. I also think it's really important to provide good information on breastfeeding. We're definitely moving toward more breastfeeding women, but in the US, our breastfeeding time is about to 6 months, years old. The World Health Organization and UNICEF recommend to at least 2, and in other parts of the world, sometimes even 4 years old. So there's definitely a stigma and a lack of education on breastfeeding as well. And I think it has a lot to do too with like the sexualization of breast and also with the pelvic floor, like we don't talk about the area down there. So it makes us uncomfortable to address these things or to kind of extend or do something different, like extend the breastfeeding longer. We also have an issue with postpartum care because women have to go back to work so early, and breastfeeding isn't always something that they can, pumping. It's a lot of work. And so supporting women who are trying to pump to continue the breastfeeding is important. A lot of women say that they would love to keep breastfeeding, but it's not feasible with their work life. And that is so sad to me because you should be able to have both. If you really want to breastfeed your baby, there should be a way to get that done for you, and you should feel supported in doing so. So even more education just on breastfeeding in general and the importance for it for mom and baby, if that's something that you choose, just because we're at a point where breastfeeding isn't considered as important or as good as it really is. And I get it because we don't want to make women who can't breastfeed feel bad. We don't want them to feel like they're inadequate or that there's going to be something wrong with their baby. But in doing that, we've kind of taken away from breastfeeding moms. So I think there should be a good happy medium for everybody. I think that if you choose to breastfeed, you should be able to do so in an easy way. And I think that if you choose not to breastfeed, then you shouldn't be judged for it. So just again, more education on all aspects of pregnancy. For women who are pregnant and postpartum, again, because fear factor is such a thing, talking about things like diastasis recti, pelvic floor dysfunction, pelvic organ prolapse, pain with sex after baby, just things that we don't talk about because we don't want to scare you. Like, don't be scared, so we just won't say it. No, these are possibilities. Pelvic organ prolapse is a possibility when you become pregnant, even if you're not pregnant. Tearing during pregnancy and having to recover the pelvic floor is a possibility. So what can we do to prep the tissue, to educate you on how your body works, and to decrease your likelihood of that happening? A lot of that has to do with exercise and breathing. So again, for doctors to just kind of refer out to doulas, to pelvic floor PTs, to pre and postnatal fitness professionals. The idea is to create a hub of people to help the pregnant woman because not one person can do it all. There's just no way. So we really want to make sure that all of our bases are covered, especially also maternal health. So postpartum anxiety, postpartum depression, to be able to say, oh, here's your 6-week appointment, you're good, go home. That leaves people feeling isolated and without information and feeling alone and that there's something wrong with them if they are dealing with any type of pelvic pre or postnatal depression. So having a group of professionals that doctors can refer out to or to push for our clients to advocate for themselves or to reach out to other people to get this information is super, super, super important. So for me, the main need in the birthing community is just education. Here is all your options. Here are things that could possibly happen. Here's things that you can do to prevent. Here are people to call if you experience any of the following. Give them everything so that at the end of the day, they can't sit there and say, well, no one told me. Thank you so much for watching this video. Please leave any questions or comments below and be sure to subscribe for more videos like this.